Vincent Tran, and this is my data story titled Severity of the Coronavirus Based on Death and Recovery Rates. This is for Informatics 143. As for the introduction, I'll be addressing the coronavirus 2019, which is a viral pathogen that is known for triggering dangerous respiratory illnesses in its host. It was first discovered in Wuhan, China. And it has been a worldwide epidemic that has led many countries to declare a national state of emergency. I'll be basing off my data on Johns Hopkins University, where there has been a confirmed 113,000 people worldwide who have had contracted the coronavirus. In this story, we'll take a closer look at the death and recovery statistics in order to formulate an opinion on whether the coronavirus is as severe as the media has perceived it to be. As for the data, like I said, is maintained by Johns Hopkins University. Sources of the data can be found here. And in the data, there is number of deaths, number recovered, number confirmed, the date, and the country where these cases are. As for the map of the coronavirus, you can see that as of March 9, 2020, it is a worldwide epidemic that has brought concerns. If we turn back the clock to January, late January is not as worldwide, which brings an interesting case at hand. As for the total worldwide confirmed cases, as of March 9, 2020, there has been 113,583 total confirmed cases of the coronavirus worldwide. And based on this graph, you can see that it's steadily increasing as the days pass on by. And now we can forecast this data and say that by March 21st, we can predict that the total worldwide confirmed cases will rise to roughly 158,000. This is an increase of 45,000 in a matter of just 12 days, which is concerning. As for the total number of deaths versus the total number recovered worldwide, comparing these two, we can see that the number recovered is increasing in a linear fashion while the deaths are stagnant. As of March 9th, there has been 62,512 total recovered cases compared to 3,996 total death cases worldwide. And this brings to question, is the coronavirus as dangerous as the media perceives it to be? As for the death rates by country, you can see that in a worldwide map, it's pretty spread out, but the percentages are pretty low. In detail, it's surprising that China is not the country with the highest death ratio. Instead, it's Iraq, which could be attributed to their disorder in their country, which has compromised their health living standards. Even though China is responsible for most confirmed cases, they only have 3.86% death rate. As for the percentages of recovered by countries, we can see it's also spread out, but the percentages are much higher. In detail, China is actually the country with the highest recovery percentage of 72.75%. Comparing this with 3.89% of the death rate, it seems as though the coronavirus is not as severe as the media has perceived it to be. In looking in China, where the origin of the coronavirus is. As for the formulas used in this presentation, the death rate is the total number of deaths divided by total number of confirmed cases times 100, and the recovery rate is total number of recovered divided by total number of cases times 100. Looking more in depth in China, the difference between the recoveries and the deaths is 55,615. The difference between the confirmed cases and recoveries is 22,000. Based on this data, it seems as though the severity of the coronavirus seemed mild. Possible reasoning for this mild severity of the coronavirus would be that individuals with the highest risk for severe disease and death include people aged 60 or older and those with compromised immune systems. As for the rest of the healthy and younger population, 80% of these people have mild disease and recovered. Therefore, for the general population, the coronavirus seems as though it's a mild disease. This brings a question the media, where it has been used as a venue to advertise the coronavirus as something as extremely deadly and dangerous, whereas data supports that the virus has mild consequences. Suggested action would be to increase media optimism. And first, we will prioritize the media's reporting of positive news rather than negative news to provide transparency to the general public about mild severity of the coronavirus. 3, an increase on reporting based on whole statistics rather than individual confirmed cases. And 4, provide easily accessible positive information about the coronavirus. This will increase the general public's knowledge of how the coronavirus is not as severe as the media has perceived it to be. Thank you.